Welcome, I'm Dr. Roberta Del Campo, and I'm a board-certified dermatologist based in North Miami, Florida. My passion is lasers, and I own a laser institute. What I'd like to discuss today are different energy-based devices, but specifically focusing on my true passion, which is the Neo Elite. What can be very confusing for many of us as providers that there are so many different devices on the market, and one might treat one skin concern, another, but really the idea is to simplify and to find a device that can target many different skin concerns. And this is where the Neo Elite comes in. So we know a 1064 nanometer wavelength can actually attack all three chromophores. So it can attack melanin, it can attack hemoglobin and water. It's also safe on all skin types 1 through 6. And therefore it allows us access to treat almost any skin concern under the sun. What's also great about the Neo Elite, and one of the reasons I brought it into my practice, is it's nice and small and compact. It's something that I can move room to room. You actually can pick it up and take it almost like a briefcase, and it is extremely reliable. I've had this device now for almost 6 years, and I have never had it break down once. I have 11 different devices in my office, many of them that I use for research, and I've had an issue with almost every single one other than the Neo Elite. So it's a fantastic device when it comes to the technology. What makes it unique in terms of the technology is we can have this short pulse duration, but get really high energies. Commonly, these devices have very high energies because of these long pulse durations, but the very kind of long pulse duration can actually cause a lot of surrounding skin damage. And so let me go to this picture here. You can see that it's very focal energy. So when we use this device, it's targeting exactly what we want it to target. So it's hitting the vessels that we want to hit. It's hitting the melanin that we want to hit. And it's not spreading that energy and causing unwanted damage to surrounding skin. It also uses a short burst of energy to really be impactful. So it's a very efficacious device, but also very targeted. And that's really important when it comes to minimizing side effects. Patients love it. Commonly, patients in my practice will say, this device sounds too good to be true. No pain, no downtime. It treats my red, my brown, my texture. And I say, it does sound too good to be true, but it actually is true. And one thing that my patients really love the most is that it is painless. I mean, commonly they fall asleep during the treatment. It's 10, 15 minutes. They don't have gel all over their face. It's sterile. And in a time in sterility and us wanting to be as clean as possible, this is really important. The device does not touch the skin. It does not use gel, yet it's very efficacious. And I wanted to throw this in there because Elle has been a patient of mine for many years. She is someone that has openly spoke about the Aerolase Neo Elite. And I will tell you that she came from another office, and we'll get into other technologies, but they were using a pico laser on her. She wasn't such a huge fan because of the downtime, the discomfort. And when I recommended the Neo Elite, she did one treatment and she was hooked. And it's something that she really believes in and speaks openly about for me. She also likes the fact that there's no downtime. And obviously, being in the public eye, we want to have treatments that we can get done and go right back to work or be in front of the camera. So this is something, again, that she has openly spoken about, and something that she is a huge fan of. And it's gentle, yet, in her words, effective. And what about providers? Well, we love it because it's something that I can pass on to a secondary provider. So I have a laser tech in my office. I trained her within about a day, and I've had 2 or 3, over the last several years. And I felt very comfortable getting them trained quickly and getting them treating patients quickly. Why? Because it's that safe and it's that easy to use. There are just a few, settings that we have to adjust, but it's basically foolproof. So this is great for an office that's looking to pass this down to a secondary provider. And again, a very reliable device, which is important in today's world. No consumables. So it is really just a phenomenal, very unique type of device. And we can treat things that are difficult to treat in many skin of color patients. So, obviously these skin of color patients have a higher risk of melanin production, so hyperpigmentation. But many devices we can't use to attack that pigmentation because it can lead to hypopigmentation or other problems. This device is safe, so it can do what many devices cannot do safely. These are all the indications and more. You can see it targets so many different skin concerns, and this really goes back to it being a 1064, so a very unique wavelength. I will say it over and over again, but a 1064 wavelength is my favorite wavelength on the market. And it's something that we can, again, use as a comprehensive treatment for our patients. So it can be used in medical dermatology, aesthetic dermatology, pigmented lesions, vascular lesions, everything under the sun. Now, acne. Acne we know can be difficult to treat. I'm going to focus specifically on acne and melasma because these are two things that I as a dermatologist see in my practice commonly, and two things that are very difficult to treat, but this is the key to success. Acne, commonly patients don't want to use topicals, they use orals, it gets better, it comes back. So we're basically putting a Band-Aid on it. With the Neo Elite, we can actually target what causes the acne, so the causative factors, the excess sebum, the P. acnes. We can also target the pigmentation and secondary changes that we have from the inflammation, so scarring, hypopigmentation, hyperpigmentation. So this treats not only the active acne, but it treats the signs of previous acne. So it's going to make your patient feel and look much better quickly. It can be used in combination with topicals and orals or on its own. And this is a paper that's going to be published soon. And it shows that there's a 77% improvement in terms of lesions with just 6 treatments. And this is long lasting. This is not a temporary Band-Aid. This is something that can basically change the skin quality, address the causative factors of the acne, and help it to resolve. And you can see this is 3 months after 6 treatments, phenomenal results. This is a combination of hormonal and traditional acne, but you can see it's also treating the erythema, the inflammation, the hyperpigmentation, the scarring. The skin looks better. Again, another result here that's phenomenal. Here's in a darker skin tone. Again, these patients are quite difficult to treat. Darker skin tones tend to have more reactive skin. We can't use other devices on them. So this is a perfect choice for those patients. And what I love most, I actually treat a lot of patients with Accutane. I'm a big believer in it. When it's prescribed safely, it's a very efficacious medication. And this is something that I feel comfortable using in combination with isotretinoin. So when somebody comes in with severe acne, they have scarring, they have hyperpigmentation, I don't have to tell them anymore, do the Accutane, wait 6 months, wait 3 months, however long you feel comfortable, and then you can start. I can tell them, look, we can start the Accutane now, the isotretinoin, and get you on this laser to improve the acne faster, but also help with the hyperpigmentation and the scarring, which makes them super happy. The results here are unbelievable. And this is with the low dose isotretinoin and the Neo Elite. And how many patients do we have that actually have poor outcomes with these other medications? They're not responding, they're non-responders. This is a great option for those patients. Or someone who just doesn't want to use topicals, doesn't want to take orals. This is a great option. Another example of improvement. And melasma, my favorite. This is why I became a dermatologist. I've had melasma since I was in my 20s. It's something I struggled with for many, many years. I tried various devices at other practices I worked at. It wasn't until I discovered the Neo Elite when I opened my own practice about 5 years ago that I realized that melasma could really go into remission. This has been my key to success. Melasma we know is caused by sun, heat, pigmentation worsens. But why? Because there's a vascular component. We know this feeds the pigmentation. So this is something that we have to treat. And many of these other devices on the market, these hybrid resurfacing lasers, nano and picosecond lasers, there are 2 big problems with them. Number 1, vascularity. This does not attack the vascularity that feeds the melasma. So sure, we can make the pigmentation look better now, but it's going to come right back. And commonly it comes back worse. Why? Because these type of devices can actually increase inflammation in the skin. When you increase inflammation in the skin with melasma, that actually can make melasma worse. So this is something that we really have to focus on. With melasma, we've shown with the Neo Elite that we have a 50% improvement with just 2 treatments with no rebound. Why? Again, it suppresses inflammation. It helps with the hyperpigmentation. It reduces the vascularity that we can see here. Here are my results. Phenomenal. You can see that this is after 1 treatment, 1 week. This was the day of my demo, and that's why I purchased the device. Another patient of mine with melasma improvement, but you can also see she has improvement from her hormonal acne, from just overall skin texture brightening. This is a one-stop shop. Hyperpigmentation, melasma, vascularity, skin texture, quality. I mean, look at just her skin looks better in addition to the melasma. I mean, look how bright and beautiful her skin looks. Another example here. So in summary, this is my favorite device. Again, I own 11 different devices in my office, and this was the first device that I bought, blood, sweat, and tears. Why? Because I believed in the technology, and it's something that I really speak about highly daily to my patients. It's something that covers all skin concerns. It's safe, no downtime, easy to use, no consumables. There's nothing that I can say negative about this device. It is the optimal device for your practice.